Hey everyone, welcome back to my channel Dental Cafe. So today we are going to discuss about a very important topic. What is cantilever process? This video will really helpful for you in clinical practice. Okay, then let's begin the video. So first of all, what is cantilever prosthesis? What it means? A cantilever or a dental prosthesis is a extension of the prosthesis that is unsupported at one end. In normal or in conventional bridge, we have a support at both the end. But in cantilever prosthesis, we have a support at the one end, and at the other end, prosthesis remain unsupported. Try to understand with the figure. This is a cast of the patient. In this we have a abutment teeth, that is canine, and a one missing lateral incisor. So look at the video. In cantilever fixed prosthesis, we are only preparing a canine. As you can see, only abutment is the canine. We are not preparing a central, but in the normal dental bridge we have to include canine and the central. So in this case, prostheses remain unsupported at the one, and this is we call cantilevered fixed dental prosthesis. This is we have a prosthesis. As you can see, we have a one crown to which pontic is attached, and at the other end we have no crown, which will go on the abutment, so there is no support at the other end. So what are the indications of cantilever prosthesis? First of all, single tooth restoration. If you are replacing a single missing tooth, then only we can use this prosthesis. Anterior tooth with good periodontal condition. If you are replacing a single missing tooth, it is very important that the adjacent tooth should be good in periodontal condition. Then the third one is the broad and the flat ridges. This broad and the flat ridges also give some type of kind of support to the prosthesis. Then what are the contraindications of cantilevered prosthesis? If you have a poor quality of bone, the abutment is periodontically compromised, and in patient with deep bite, because we want canine guided occlusion. So in bite cases, it will affect the type of forces acting on the prosthesis. So it is contraindicated. So basically we have a two types of cantilevered prosthesis. One is for anterior cantilevered prosthesis and second is posterior cantilevered prosthesis. Again, in anterior and posterior we have two types, with wing or without anterior wing. But the posterior cantilever prosthesis is not usually preferred because pontic act as a lever and that tends to be depressed under the occlusion forces. So usually not preferred. And what is the anterior cantilevered prosthesis? Let's see. So look at the video. Replacement of a maxillolateral incisor with a canine as a abutment is a classic example of anterior cantilevered fixed dental prosthesis indication. And anterior cantilever processes show more success than the posterior because less forces are acting in the anterior region. But remember, occlusion should be canine guided and there is no deep bite. So this is we have a cantilevered fixed dental prosthesis after casting and ceramic layering. And in this prosthesis we have a wing. So only single abutment, that is canine, is prepared and the rest is given on the central incisor. We are not preparing central incisor as a whole, we are only giving a rest on the central incisor. So it's an extension of the prosthesis, so it's remain unsupported at the one end, and this is we called cantilevered prosthesis. And this is we have a conventional bridge. As you can say, it got support from anterior and from the posterior to replace a single missing tooth. So it have a two abutment, but the cantilever have only single abutment. So this is we have a summary of the entire video. In cantilever we have a wing, we have a one pontic and a one crown. In conventional bridge, we have a two abutment teeth and a one pontic. So first one we have a cantilever bridge, and the second one we have a conventional bridge. So what are the advantages of cantilever prosthesis? From the start to the end of the video, I'm repeatedly saying it's a conservative procedure and a cost effective for a patient, not for the dentist. So this is the basically a very good advantages of cantilever prosthesis. It's an it's a conservative procedure because it involves single abutment tooth. When secondary abutment are used, parallel preparation can be easily obtained because abutments are adjacent to one another. Disadvantages: it produces torquing forces on abutment, basically in posterior cantilever prosthesis. You can you hardly face this torquing forces in anterior cantilever prosthesis. Cannot be used to restore long span edentulous spaces because it is not strong enough to withstand the occlusal forces. I hope this video is helpful for you to understand what is cantilever prosthesis. If you want more such type of clinical video, do comment on comment section. And yeah, don't forget to like, share and subscribe my YouTube channel and hit the bell icon for the latest update.